Okay, actually, I'm the coordinator of the project, the full project. I'm Jesús Hernández. I'm working in Salamanca University as a hematologist and also as full professor of hematology at the university. So, actually, I'm the coordinator. We sent the proposal to the IMI, trying to collect from the very beginning of the project to be a comprehensive and inclusive project instead of something very particular. We know that this project is one of the first big data for better outcomes project. And we know that hematological malignancies were out of the scope of the IMI projects before. So what we want to do at that time, and we are starting to do, is to collect a comprehensive series of universities and hospitals across Europe. And this is one of the most important things that we have collected. We have included, I think, about 25 institutions, 25 hematologists, leaders in the different diseases in harmony. And another characteristic from the very beginning from the project was the inclusion of not all, but almost all the stakeholders involving in the hematological malignancies, coming and finishing in the patients, because the patients are the really most important product, the most important thing that we have in the project. So coming from the patients and finishing in the patient, and in the middle, regulatory agencies, health economists, regulators, payers. So all the instances included in related to hematological malignancies. So it is my role is to do the coordination. Actually, and from now of 53 partners, 45 coming from the public or some companies, but mainly publicly found, and 8 pharma companies. So it is a huge project, a lot of partners, but we want to cover all the possible angles about the hematological malignancies. Well, it is a very good question. So the first months that we have developed now, we started in Salamanca meeting and a kickoff meeting 9 months ago. So in fact, we are still on the first year of the project. Well, we have established a good communication, a good trust between the different partners. We have to put in contact the public and the private partners. They have to collaborate, and they have to understand each other. Sometimes it's a problem of communication, it's a problem of semantics, even about the different meanings of the words. So we don't have, we shouldn't forget that there is not only a scientific project, it's a project involving several stakeholders, several layers of activity, and to put together all these interests and all these people, it has been one of the major achievements. We have built a database to include the big data coming from patients, coming from the public institutions, and hopefully in near future coming also from the industry. It is also an important achievement because we have some agreements with some companies in order to provide data sheets from already published clinical trials. And we want also to include associated members. We cannot be 100 partners, but the way to don't exclude anybody who is interested in the project is to have a new figure named associated members who will be involved in the project not as a full partner, but with a special contribution. And here in Berlin meeting, it has been, I think, about 10 or 12 of the first associated institutions that we have signed a contract with there. And in the near future, we will receive some others. Some of these contracts are still reviewed by the different lawyers from the different institutions. Well, in the next year, we hope to start to work in the database. The database is already built. It's placed in Bologna and is built and is able to receive data and is able to start to produce results, to produce analysis of the data. Until now, we are just feeding the database with public data instead of non-public data, because we have to finalize all the items regarding privacy of data and so on. All these issues that have been resolved in the different work packages that are mainly the basis of the work in Harmony. Well, first of all, the first one is that there is a really enthusiasm in the hematological community. So I think all the people is really interested in the project. It is the project is not only a hematological project; it's also is involving all the structures and different structures in Brussels and different associations. Let's say patient association, pharmas, and also regulatory agencies and so on. We are planning to establish a stakeholder forum in which several institutions coming not only from patient association but also from HTAs, from regulatory agencies are welcome to be involved in the, let's say, in some way, in order to sit in the same table or in the same meeting, all the stakeholders involved in the field. So it is something that this is really a critical point. On the other hand, we also have a huge tradition in the analysis of large series of data coming from omics data, coming from next generation sequencing, microarrays, and we are also planning to use all this new knowledge and trying to relate this new knowledge with outcomes that we can estimate. In hematology, we have analyzed several outcomes, not only overall survival, but also disease-free survival, and many others like relapse-free survival, response to the therapy, and so on. But now maybe it will be the way to, by analyzing a series of big data coming to the database, that we will be able to establish a new set of outcomes. That it is one of the main roles of the main goals of the project. I think this is from the beginning. It has been an open project for everybody is welcome. So we needed the support for the real world data, not only for clinical trials. From the published data, they are okay, they are really welcome, but also we have to work at a real world level and trying to improve the results, the outcomes, the quality of life of our patients, and trying to provide a kind of, let's say, some good news about the health sustainability system.